My name is Dr. Wolfgang Grisold. I'm a neurologist from Vienna, Austria, and I'm the president of the World Federation of Neurology. It's my pleasure to welcome you to this webinar on brain health for all, which is organized by the World Federation of Neurology jointly with the 6 regions of the world. The World Brain Day this year has this important topic, which is based on the IGAP, which is the intersectoral action plan on epilepsy and other neurologic disorders. And this gives us a big chance, a great chance to implement neurology based on brain health around the world. This year's novelty is that we will also have a speech from the WHO, and we have also implemented a talk from a patient and on behalf of a patient organization, which is also a new feature. Then you will also hear statements from the 6 regions of the world presenting what is important and how they will implement brain health and what they can do. But I will make you familiar with this year's World Brain Day taglines. The first one is awareness. Brain health is vital for mental, social, and physical being. Secondly, prevention. Many brain disorders are preventable. Thirdly, advocacy. Global efforts are required for optimal brain health. Fourthly, education. And education is key for implementing brain health. And finally, access. Equitable access into therapy and rehabilitation is key for brain health. This sounds easy, but needs a lot of work and a lot of effort in many regions of the world, in particular in low-income regions. I invite you to join this webinar, listen to our speakers, and also promote the message of brain health among your fellows and among your community. Thank you very much.
Being born as a human being is a miracle. So you are a miracle and I am a miracle. Being born as a human being is mathematically calculated to be a miracle of 1 in 400 trillion chance. What makes us a uniquely special species among rest of the other animals? It is our brain. Although if you look at a human brain and probably even a brain cell of a mouse and a brain cell of a human being, to the naked eye, you might not see much of a difference between these two neurons. However, the remarkable ability of human brain cells to connect with each other, make new connections, which are known as synapses, and our social ability to adapt and work together makes us the most successful species in this planet. Unfortunately, human brains are at a crossroad right now. Brain disorders are the leading cause of disability and second leading cause of death worldwide. To make matters worse, 70% of the brain disorders affect where 70% of the world live, in other words, low to middle income countries. That makes it extra hard and further burdensome globally. But it is time to action. The much awaited World Health Organization IGAP and the next 10-year action plan, the decade for the brain, put us in unique position to bring the entire world together to promote brain health for all. Let us listen to our esteemed speakers who will continue to inspire us on raising awareness, education, advocacy, improved access, equity, and rest of the other key important things with a ambitious agenda of promoting brain health for all worldwide.
Hello, everyone. My name is David Dodick, and I have the great privilege and honor to be this year's World Brain Day co-chair. I am particularly excited about this World Brain Day because I believe it will mark the beginning of a renaissance for the brain and a decade of unprecedented growth in support of those affected by and at risk for neurological disorders. I say this for two reasons. First, on May 27th of this year, the World Health Organization member states unanimously approved the Intersectoral Global Action Plan, or IGAP, on epilepsy and other neurological disorders at the 75th World Health Assembly in Geneva, Switzerland. This was a landmark decision and an initiative that promises to address the challenges and gaps in providing care and services, as well as help strengthen the prevention, the detection, care, treatment, and equal opportunities for people with and for people at risk for neurological disorders worldwide. Second, the advances in biomedical science, diagnostics, and therapeutics has led us to a time when a substantial proportion of a number of the most common and disabling neurological disorders are predictable, preventable, or detectable at their earliest onset. With our knowledge of modifiable risk factors and evidence-based interventions, and our ability to measure, to monitor, and to optimize the health of the brain with precision, we are poised, I believe, like never before, to prevent an enormous amount of human suffering and preserve what makes us human, our brains. So I'm excited today to be able to introduce some pioneers and leaders who have helped bring us to this stage and who will help lead us through this most opportune of times. We will hear from Dr. Taryn Dua, Medical Officer of the Brain Health Unit at the World Health Organization, who will speak to us about the Intersectoral Global Action Plan that was recently approved at the World Health Assembly. We will also hear inspiring messages from people who have each led and been champions for each of the 5 pillars of World Brain Day and the World Federation of Neurology's Brain Health Initiative. Specifically, we will hear from Professor Osterk on education, Professor Martins on prevention, Professor Leonardi on awareness, Dr. Orla Galvin on advocacy, and Dr. Sharway Felly on access. Thank you all for being with us today, and thank you for the work you are and will continue to do to capitalize on this moment in time to ensure that we do what we have the capacity to do to optimize the health of everyone's brain.
Greetings from the World Health Organization. I'm very happy to address you on this year's World Brain Day, especially so because in May of 2022, the 75th World Health Assembly adopted the 10-year Intersectoral Global Action Plan on epilepsy and other neurological disorders. The action plan comes with a vision of which is a world in which brain health is valued, promoted, and protected across the life course. Neurological disorders are prevented, diagnosed, and treated, and premature mortality and morbidity are avoided, and people affected by neurological disorders and their carers attain the highest possible level of health with equal rights, opportunities, respect, and autonomy. The action plan has its own strategic goal, guiding principle, and strategic objectives. And each of the strategic objectives include different action areas. The strategic objectives cover prioritization and governance, effective, timely, and responsive services, strategies for promotion and prevention, research and innovation, and public health approach to epilepsy. The action plan includes actions for member states, WHO Secretariat, international and national partners. and it also includes 10 voluntary global targets. But do note that country can set their own national targets, taking into account national circumstances and challenges. As a technical complement to the action plan, WHO worked with a group of international experts, including people with lived experience, to develop a position paper on optimizing brain health across the life course. The position paper, which will be launched on August 9th, and you have the QR code on the slides to register and attend, provides a conceptual framework for brain health and its optimization. The position paper outlines determinants of brain health, which includes physical health, healthy environments, safety and security, learning and social connection, and access to quality services. It also describes some of the projected impacts that optimizing brain health would have for the individual as well as for society, and offers practical policy solutions and future directions for generating evidence, developing norms and standards, and validating metrics and tools to understand brain health better, and in particular, returns on investment in brain health. We fully agree with the key messages outlined by the World Federation of Neurology, and would add that optimizing brain health for all is paramount to ensuring human health and well-being globally. The time for action is now.
Hello world, today is the 22nd of July 2022, and it is World Brain Day, which is a very important day. I am a neurologist from Italy. My name is Matilde Leonardi, and I am the director of Neurology Public Health Unit and of Coma Research Center in Milan, Italy. I've been working for the last 30 years on the public health aspects of neurology, and this year I was very happy to see that the WHO has been ratifying, the World Health Assembly has been ratifying last May the WHO GAP, the Global Action Plan on Epilepsy and Other Neurological Disorders. Why I'm happy? Because I think that in this day, we are marking the fact that we are all aware that the burden of neurological disorders is relevant, is affecting people of all ages in all parts of the world. And this is per se, it's an issue of public health. And I think that the context in which we work is seeing an epidemiological transition, rising up of neurological disorders, and the increase of diseases that require better diagnosis, better treatment, and better care. And I also think that it is very relevant to understand that we are in a very relevant policy context. The policy context is comprised different actions. I would say that you have the UN with the Decade of Healthy Aging 2021 and 2030 that is framing, together with the baseline report of Decade of Healthy Aging, the age quake, the epidemiological transition that is seeing an increase in all countries, including the low and middle income countries, of an aging population. Also, there is the need to reach the Sustainable Development Goals, in which the goal number 3, health, is certainly very relevant for all our people and our patients worldwide. Also, in our context, there is the big non-communicable disease global strategies, that is the WHO and the global strategy for looking at the impact of non-communicable diseases, including mental and neurological. But also the context in which we live is a context which has been facing the COVID pandemic, which we'll see in the next months a rising up of disabilities, particularly related to increase of stroke, as well as the lack of some outpatient evaluations that have been lost due to the COVID pandemic. In all this scenario, the Global Action Plan on Epilepsy and Other Neurological Disorders is bringing in the issue of brain health. Brain health that is valued, promoted, and protected across life course. And why this is important? Because we as neurologists, we tend to speak about diseases, but what we are launching today is important to speak about the health of our brains, the health of the brains of all citizens. And the key messages in terms of awareness that it is important that we keep with us is that brain health is essential, and brain skills are central to the development of brain capital and brain economy. So we need cognitive, emotional, social skills that are connected to the health of our brains. Also, brain capital it is the creativity, the knowledge, the skills that every individual is improving during the lifetime. And then this brain capital enable everybody to realize the potential and contribute productively and meaningfully to the economy of the society at large. And promoting brain health is key to the development of brain capital, which is itself mandatory for the human capital development. So brain health is necessary for the attainment of the third sustainable development goal. If you don't have brain health, how can you reach health? Development goal number 3, that is related to brain health, is central to the attainment of the other sustainable development goals. So in line with this, the European Academy of Neurology, of which I am a board member, it's been launching in the brain health strategy. And this brain health strategy is going to affect the 47 countries of Europe. And as you know, the European Academy of Neurology has more than 45,000 neurologists represented there. And in the 47 countries, we, as European continent, through the European Academy of Neurology, are going to promote brain health, which will require all of you to become brain health ambassador. All of you listening to this and all those that are not listening to this, please involve them, because we are in face of a neurology revolution, because the WHO Global Action Plan is propelling neurology and brain health to the forefront of the global health. So the health and development agenda will be needing an harmonized neurology community. So we will need what? We will need brain health ambassadors, people that in all countries will have to promote the neurology revolution brought in by the convergence of the Global Action Plan and the need for brain health to become central to the attention of politicians, administrations, national authorities, and all citizens at large. So, brain health ambassadors listening to me in this moment, please get engaged and join the brain health campaign that WFN is launching worldwide. So enjoy this day and think to your brain health. Thank you very much.
My name is Tina Chawi Feli, and I'm the president of the African Academy of Neurology. There is great inequity when it comes to access to specialized care with respect to brain health. This holds true across the entire planet, but is particularly stark on the African continent. As a neurologist, I will speak to the access to neurological care, although the situation is very similar for most of the other specialties related to brain health. The World Health Organization recommends a neurologist to 100,000 population of 1 to 5 per 100,000 population. On the African continent, the only country that satisfies this criteria is Tunisia. More than 5 countries have no neurologist at all. The average neurologist to population ratio is 0.12 per 100,000 population. Even within countries with neurologists, there's great variability in real access to care, even within one city. The African Academy of Neurology did a survey of its member countries and found that in countries with neurologists, the vast majority are located in large urban centers, mostly capital cities, and also mostly within tertiary academic institutions, creating significant bottlenecks in access to care. The goal of the African Academy of Neurology, as it participates in the promotion of brain health, is to work towards the removal of the inequities of access to care by fostering training of neurologists, increasing neurological awareness and education in neurology for primary healthcare practitioners of all levels, widening networks for collaboration across different regions of the continent. By participating in advocacy and awareness campaigns for the general public, we're also contributing to making the individual an important stakeholder in their own brain health and creating awareness on the importance of protection of brain health for our children, adolescents, young and mature adults, and maintaining that same brain health as we transition into healthy aging. When disease inevitably occurs, differentiating between what is normal and abnormal is important, and knowing the pathways to access to care, both for the individual and the gatekeeper, who is the primary healthcare provider, is vital. Our ultimate goal is to achieve the following: anyone, anywhere, irrespective of geographical location and socioeconomic status, should have universal health coverage, and this should most definitely include access to specialized neurological, but not only, care. As we dedicate today to brain health, we should remember that it deserves attention every day. And the old adage holds true: prevention remains better than cure, especially when often there is none, as well as inequities in access to care. And we should focus much of our attention on the maintainment and preservation of brain health as we continue working towards measures to help restore brain health when it fails. I wish you all a healthy, happy Brain Health Day.
Hi, I'm Sheila Martins. I'm a president-elect of the World Stroke Organization, and it's a great pleasure to be here today to talk about World Brain Day. Brain disorders are the main cause of disability in the world. They can happen in every age, sex, or socioeconomic class. To recognize the brain disorders can help you to prevent and to treat them. In the world, 15 million people live with dementia, and 40% is preventable. 50 million people live with epilepsy, and at least a third is preventable. 15 million people have a stroke each year, and 80 to 9% can be preventable. So, preventable and treatment is available for other neurological disorders as migraine, Parkinson's disease, and multiple sclerosis. Smoking, hypertension, diabetes, obesity, depression, physical inactivity, alcohol abuse, and air pollution are all risk factors for cognitive decline in dementia and also for stroke. To learn how to identify these risk factors and how to treat them properly can decrease the global burden, decreasing the number of stroke and dementia in the world. Some simple actions can have a huge impact in your brain health. The increased burden of stroke and dementia in the world provides strong evidence that currently used strategies are not enough. Only to treat the high-risk patients don't decrease the incidence of stroke and other cardiovascular disease in the world, and the numbers are increasing. 80% of strokes and other cardiovascular disease occur in people with low to moderate risk of stroke. There is a pressing need to identify new, well-tolerated and accessible strategies for this majority of people that reliable reduce risks in all countries in the world. And decreasing the burden of stroke, we can decrease the burden of dementia too. We know that small reductions in the blood pressure can reduce 10% of number of strokes. Early identification of these people and treat with lifestyle modification the whole population can really decrease the burden of stroke, and we need you for this. We have several unrecognized and untreated comorbidities or undertreated as hypertension, diabetes, dyslipidemia, and atrial fibrillation. We know what we need to do. So how to implement, how to modify lifestyle risk factors? We know that we need to eat better, lose weight, get active, reduce blood sugar, stop smoke, reduce alcohol. But how to stimulate people to modify the lifestyle risk factors? So we need you to know about the disease, to recognize your own risk factor and help us to decrease the burden of this disease. Together, we can save billions of lives in the world, promoting health lifestyle choice and activities that reduce the prevalence and progression of brain disorders. Thank you.
Thank you to the World Federation of Neurology for allowing the opportunity to present EFNA to you today on World Brain Day 2022. EFNA, or the European Federation of Neurological Associations, brings together umbrella organisations of neurological patient advocacy groups to work together with other associations in the field of neurology. Our slogan, Empowering Patient Neurology Groups, encapsulates our goals as an association. We strive to add capacity to our membership allowing them to be the most effective patient advocates possible in their own disease-specific areas. EFNA embraces the concept of a partnership for progress, and this means working at a very high level with relevant stakeholders in the fields of policy, medicine, science, research, industry, with other patient partners and other key opinion leaders, all to achieve our vision. Our vision is for a better quality of life for people in Europe living with a neurological disorder. How do we achieve this? We aim to achieve this through our strategic action areas, and they're easy to remember as ACE: advocacy, collaboration, and empowerment. So what does this mean? What actions do we take? This can be described through the EFNA mission. The EFNA mission is to be a voice for neurology patients across Europe. Our mission is to raise awareness of the prevalence and impact of neurological disorders, with the aim of leading to a reduction in stigma, isolation, discrimination for neurological patients, for their families and carers. Our mission is to ensure policymakers, opinion leaders, and decision makers in Europe, and indeed across the globe, recognise the increasing socioeconomic and health burden of neurological disorders, and as such, allocate appropriate resources for the prevention, treatment, services and support that are very much needed for our community. Our mission is to communicate and collaborate with our membership to achieve a positive change and to ensure that our actions as EFNA add value to their own concerns and activities. Our mission is to motivate, inspire, and empower those living with neurological disorders, leading to a more meaningful involvement and engagement of patient advocates in all areas, including policy and decision making and in research and development. To say all this, our successes have been based on a united approach by establishing strong partnerships and alliances with key stakeholders in the scientific, clinical, political, and corporate arenas, all to help achieve our strategic objectives.
Good afternoon. Today is a very important day for Brain Health, World Brain Day. I'm Professor Şerif Nuröztürk from Turkey, Konya. I work at Selçuk University, Neurology of Department. And Konya is a very nice, very green, very peaceful historical city. Yes, education is very important for every area, for every aspect of life, but extremely important to increase healthcare. Brain disorders disproportionately affect women, older people, minority populations, including refugees and migrants, and those living in especially rural and remote areas. Public education will improve brain health and reduce the global burden of neurological disorders. To address the global burden of brain disorders, the world needs more healthcare workers who are knowledgeable about, as well as those who specialize in brain disorders. Advocacy is another important subject and is very important to increase neurological care. As neurologists, we must be very active advocates for neurological disorders. Making strong and effective advocacy is possible with an effective education. And this could be possible in lifelong professional development, starting with medical school, with medical education. Education is very important for prevention of neurological diseases. Recognition and prevention of risk factors, recognition of disease symptoms, early treatments, and appropriate treatments, including neurorehabilitation. Education can be carried out in different ways at different individual and social levels. Individual education should be started in the family in a very early stage of life and schools in childhood and should be continued in all social areas. Education on the importance of healthy diet, clean environment, sleep, healthy sleep, physical activity can create habits that optimize brain health for life. Education should be modified in the most effective way according to the individual and social characteristics. As human beings, we are very different, very heterogeneous. So, gender, age, economic status, language, and cultural differences shouldn't interfere with education. Education should be delivered to every single individual in the society and it should be aimed to establish a healthy lifestyle. Different ways and all possibilities should be used to reach individuals and societies for education. Family members, especially mothers, mothers are really very important to start an effective education for healthy life. uh, to increase teachers' awareness and to use non-governmental organizations and community leaders, very, very useful. And we can try to collaborate all these parts of education together. Promotions can be useful in social media, cinema, television, and printed media, brochures, hospitals, waiting rooms, areas where individuals are gathered. As another potential tools, we have smartphones. Smartphones can be used to reach individuals. Education and prevention is the most rational way, most cheaper way, most effective way to prevent the burden of neurological disorders. Education for a healthy brain and a healthy life should be the basic right for every individual. This is a human right. Thank you very much.
Hi, I'm Dr. Orly Avitzer, President of the American Academy of Neurology, the world's largest association of neurologists with more than 38,000 members in 144 countries. We are proud to support this year's World Brain Day and highlight the importance of brain health for all. For almost 20 years, the AN has demonstrated its commitment to brain health through its public outreach. And the pandemic has reinforced the need for neurologists to work together across the globe to be attentive to disparities in healthcare which adversely impact brain health. One of the ways we have shown this commitment is through our highly successful Brain and Life magazine and website that reaches millions of patients and caregivers. We're honored to have had many influential people grace its covers and demonstrate their commitment to brain health, including Michael J. Fox, Gloria Estefan, Sharon Stone, Dame Julie Andrews, Courtney Cox, and Renee Zellweger. For our Spanish-speaking readers, we also publish a popular quarterly magazine, Brain and Life in Espanol. As editor-in-chief of Brain and Life, I am proud to share that we recently launched a new Brain and Life podcast hosted by two AN neurologist members who speak with people whose lives have been impacted by brain conditions, and to neurologist experts and to advocates to educate and inspire listeners to maintain a healthy brain. You can listen to stories about brain health from wherever you are in the world. On behalf of neurologists and their patients, the AN advocates to policymakers and other stakeholders who influence legislation in the United States, and our network of neurologists, patients, and caregivers work to improve patient care by demonstrating the value of neurology and the importance of neurologic treatments, research, and access to care. While we've had many advances in therapies to help patients improve the quality of care, AAN neurologists and neuroscientists are endlessly committed to research, finding ways to not only better treat neurologic conditions and diseases, but to prevent problems that affect the brain and the nervous system. The AN is committed to promoting the importance of brain health and expanding our efforts even further. Please join me and the American Academy of Neurology in supporting the World Federation of Neurology's World Brain Day 2022 and this year's call to optimize brain health and reduce the global burden of neurologic disorders. A healthy brain is a healthy you.
My name is Tina Chawifeli, and I'm the president of the African Academy of Neurology. The African continent has a population of 1.3 billion persons and growing, and more than 50% of this population is under the age of 25. That is, the population is a young one. And even though the continent is undergoing demographic changes with increases in life expectancy, we have the unique opportunity of realizing in real time the benefit of the protection of brain health. The continent's most precious resource is its human resource. Every single person is a stakeholder in the strategies geared towards the protection of brain health, right from the moment of conception, in fact, before, via maternal health, during development in the mother's womb, through birth, throughout childhood and adulthood. Our nutrition, cognitive stimulation, education, psychological well-being, and a multitude of other factors play a role in maintaining and improving brain health. Our brain health is what makes us our individual selves and allows us to live to our best potential. When impaired, the same brain, now unhealth, can cause significant suffering and reduction in quality of life. We, the neurologist, whilst at the wrong end of the brain health equation, are also best positioned to advise on the importance of the protection of the said health. Because once damaged, the implications of impaired brain health has a multitude of outcomes, not only on the individual living with neurological or mental health disorders, but also on the family and the community, and has a notable and tangible socioeconomic implications with loss of productivity and income, cost of care, and often further slide into poverty. Neurological disease and other conditions that impact on brain health are ubiquitous. However, we also know that the burden of these diseases and disorders are more prevalent in countries of low and middle income, to which the African continent belongs. For example, for epilepsy, the 50 million of those living with epilepsy, 80% are found on the African continent. General health can only be achieved if we place emphasis on the large impact of brain health on it. Universal health coverage cannot be achieved if we do not consider brain health. It is now well understood and not just a slogan, really is no health without brain health. Brain health and its protection should be a public health priority for our countries. As said earlier, every single one of us is a stakeholder, but some of us are in positions to further protect that brain health. Our midwives and obstetricians, the whole primary healthcare system, everyone involved in maternal health, neurologists, psychologists, psychiatrists, other subspecialties, our religious and political leaders, and you, the individual. We all should play our part in protecting our most cherished possession, the thing that makes every single one of us unique and invaluable, our brain health.
Hello, everyone. My name is Professor Dr. Hamidun bin Basri. I am from Kuala Lumpur, Malaysia. I am the president of the AOAN. And AOAN represents the Asia and Oceanian region, which consists of more than half of the population of the world. It is represented by 21 member neurology associations from countries across the region. We will enhance our efforts in promoting the brain health for all, and the World Brain Day will be in the center of it. Creating awareness in preventing and treating the many brain diseases is of utmost importance. This will be incorporated in the various conferences and workshops that we have planned in the region. There will also be region-wide activities to promote the World Brain Day. And just to quote a couple of examples, in India, the Indian Academy of Neurology is planning to have 100 events for 1 week in conjunction with the World Brain Day 2022 where programs include patient education programs, meetings, webinars, drawing competitions, and fun run for the brain. The Korean Neurological Association is planning to advertise World Brain Day 2022 widely in public. A series of interviews in conjunction with the World Brain Day is also under the pipeline. The Asia Oceanian Association of Neurology will also post the banner advertisement on our webpage and share the post with all our partners. So ladies and gentlemen, please do join us in this effort and spread the word. Brain's virtual role in humanity and how we can reduce the burden of brain disorders in the world. Brain health for all. Thank you.
July 22nd is World Brain Day, and this year the theme is Brain Health for All, as people all around the world continue to be challenged by pandemics, wars, climate change, massive disparities in health equity, and many preventable diseases. EAN is committed to supporting World Brain Day, along with the World Federation of Neurology. Professor Claudio Bassetti, how has EAN promoted brain health during your presidency?
If we talk about brain and health, means we have to talk to brain specialists, the neurologists. So we have been working tightly with the World Federation, with the young neurologists of our association and many other regional and even national neurological societies. On the other hand, if we talk about health, we need to talk with the health specialists. So, for instance, for the preparation of our strategy, we worked with social and preventive specialists. And during the summit, just a few weeks ago, the EN Brain Health Summit, we actually involved also policymakers and representatives of the national health ministries. And I would like to mention in particular the Ministry of Health, Mr. Valek of the Czech Republic.
Thank you. Professor Paul Bone, what initiatives do you have planned to promote the importance of brain health?
Well, we will keep working with the national neurological societies. They're really the backbone of our political force. And we will do so together with other international stakeholders, mainly the World Federation of Neurology. It is really important that we keep on the same page, trying to foster our plan and our strategy through the implementation of national brain plans and global implementation.
Thank you. Thank you, Professor Bone, and thank you, Professor Bassetti. And we ask all EAN members, colleagues, and partners to join us in supporting World Brain Day to ensure brain health for all.
I am Professor Marco Tulio Medina, President of the Pan American Federation of Neurological Societies, PFNS, a WFN chapter. We are promoting the World Brain Day. Brain diseases represent a major health challenge since they are the main cause of disability in our region. Latin America has been working on very important projects at the regional level, particularly in the Strategy and Plan of Action for Epilepsy approved by the Pan American Health Organization, PAHO, to prevent and promote the management of epilepsy in the region. After 10 years, outstanding results have been achieved by this plan, including the creation of 2 World Health Organization collaborating centers in Latin America, particularly in Chile and Honduras. Furthermore, a specific program has been developed to create awareness and reduce neurocysticercosis in Peru and Honduras. The current initiative for our organization is to promote the global agenda to reduce neurological diseases, adhering to the Epilepsy and Other Neurological Diseases Plan of Action fostered by the World Health Organization, as well as promoting the area of tropical neurology, particularly with the reduction of neglected diseases.
I am Dr. Maged Abdel Nasir, Professor of Neurology, Cairo University, Egypt. I am the President of the Pan-Arab Union of Neurological Society. This organization includes more than 20 Arab countries And of course, these countries are different regarding the socio-economic level, ranging from low, middle to high income countries. And according to such socio-economic status, each country has its challenges. For example, the low-income country has low number of physicians specialized in neurology, and they are somehow lacking the neurological services in specific and medical services in general. So in the Pan-Arab Union of Neurological Society, we are trying to improve the awareness regarding brain health throughout the community and throughout the young neurologists. And in my country, Egypt, there is a big advance happening in the last few years, especially in stroke and multiple sclerosis subspecialty. Such specialty have medication which are completely reimbursed through the Ministry of Health. Throughout the COVID-19 era, we held in the Pan-Arab Union of Neurological Society many Zoom webinars in order to raise the awareness of neurological problems and educate young neurologists in different Arab countries. And it's my pleasure to announce that in next July, we'll have a movement disorder conference in Egypt with attendance of young neurologists throughout Arab worlds. Thank you.
What an outstanding inspirational session that had been. Inspiration to the core. I am sure there are many questions from our attendees from all over the world. Very good day to all of you. We got the first question. Let me pose this question to Professor Matilda Leonardi.
Hello, can you hear me?
Hi, Matilda. So the question that is coming on our way is difference between mental health and brain health. I think you are the perfect person to answer this question.
Thank you very much. It is a long story that has been debating about differences. I would like to speak about the commonalities. Both mental and neurological disorders derive from the brain. The policies that might face them could be different. And I think that we are talking here about Brain Day because we are all caring, those dealing with neurological and those dealing with mental disorders, about the safety and the care of the brain and of all the things that surround the persons. And I think that mental health is just dealing with the person who has a psychiatric disorder, and the psychiatric disorder and that their mechanisms, they derive from the brain. So I believe that it's an issue of thinking about the person in the environment. We might focus more on some pharmacological treatment, but we all have to take care of the environment as facilitator for people with mental and neurological disorders.
Thank you, Matilda. Over to my co-chair, Professor David Dodik, to pick the next question and pose that to the relevant expert.
Thank you, Tissa, and good day to you all, and thank you all so much for being here today. The next question I would like to ask Dr. Sharway-Felly, actually. Dr. Sharway-Felly, you highlighted the need for equitable access and the drastic shortage of neurologists in Africa. So could you speak to us about what the short-term priorities of the African Federation of Neurology is to begin to close this gap? Dr. Sharway-Felly, are you there? Can you hear me? No, well, perhaps I will go on then and ask Dr. Martins. Are you there, Dr. Martins?
Yes, I'm here, but I cannot open the camera. I don't know why.
That's okay. If you wouldn't mind, we have a question here for you, and that is that prevention, as you nicely outlined, is a focus of this year's World Brain Day. And you and others emphasize prevention, but neurologists generally see patients after their disease has already begun. Many of the modifiable risk factors that you talked about are managed at the primary care level. So how can neurologists influence the management of these risk factors in an effort to prevent people from indeed becoming neurological patients? And then do you foresee a future where preventive neurology and brain health clinics are established to identify and manage people who are at risk?
Yes, well, I think we as neurologists should be involved with this, and I think it's our role to aware the primary care physicians and primary care professionals about the importance to prevent and the deep impact you can have if you prevent if you treat hypertension, if you identify diabetes, dyslipidemia, atrial fibrillation, we can modify billions of lives. So I'm now in the primary care units working together with primary care physicians and nurses to change this. I think our view, and not only my view, but my view, working together with cardiologists and endocrinologists, nephrologists, can help to reorganize the primary care, the cardiovascular care in primary care. We are working with a World Health Organization plan that is HEART's program, and I think we have success doing this together with other specialties, and you can make a huge difference because I think it's our role to decrease the incidence of stroke and dementia acting in primary prevention.
Thank you so much, Dr. Martins. Tissa, back to you. Tissa, we cannot hear you.
What a fabulous webinar it had been. Thank you. I'm seeing another question coming through. Let me read this out. The question is, what are the key areas of brain health education that will help give brain health the same importance as other diseases like heart and cancer? Let me see who can answer this question. I think Serafina Ostrak from Turkey is the perfect person to nail this question. Very good day to you. Just tell us your view on this question.
Thank you very much for this opportunity. Unfortunately, neurological disorders cause to decrease voice of patients and relatives. So we don't have many too high voices to increase awareness and to increase our rights. So critical potential areas, potential environments for educations are starting from families, as I said. Families is really very important. And schools, primary schools, high schools, we need to educate teachers and students over there. And medical schools must have a special core curriculum for education and prevention of neurological disorders, because this is the most important health burden actually in the world. And primary care level is extremely important. So you can educate your patients at this level very effectively. And societies are important. Parliamentals, making effective lobbying is really important, because after a heart attack or during the cancer, patients can tell about their diseases and request some rights, request some potential increase in their coverage, in their preventive or treatment measures, treatment level. But during the neurological disorders, this is really very, very difficult. And municipalities, local authorities, and media is really very important. Even television serials are very important potential areas to increase education and awareness. And smartphones, this is also very, very important tool to reach every single individual. And this must include all minorities, including refugees, migrants, and some minor ethnic populations, actually all different populations. Thank you.
Thank you so much, Dr. Al-Saturk. There is a question here, which is an important one as we hope to move forward and enable and galvanize the entire global community to be able to promote and enhance brain health for everyone. So I'm going to ask Dr. Galvin to answer this question. The question is, how can I advocate for better global brain health in my own community and in my circles?
Thank you. So in order to advocate and influence successfully, whether as an individual, as a patient, or as a caregiver, or indeed as part of an organization or as a clinician, you really should first equip yourself with robust, reputable information and data, and then engage as many stakeholders as you possibly can to create the awareness that many of the speakers today have spoken about. Awareness is absolutely critical, and communicate. Target as many influential individuals as you can. And of course, we will always think of the health sector first and engage with our politicians engaged in the health space. But as we know, neurological disorders and brain health conditions have a huge socioeconomic impact as well. So we should really be targeting and engaging with the ministries involved in finance and indeed social welfare and protection. So they are very much a first step. In a smaller circle, engage with those who are engaged in the disease area that you're interested in the region that you are working in. And of course, you can also engage at the regional and global level as well.
Thank you, Dr. Galvin, and thank you for being here today. Back to you, Tissa.
Thank you, Ola. I am raring to go now to raise community. The Dr. Augustina Chavez-Felli, Tina, thank you so much for your great talk. The question is, you did highlight the need for drastic shortage of neurologists in Africa. The question that is coming through is, what are the priorities for African Academy of Neurology in beginning to close this gap in access? If you could nail the answer within a minute, as we had some technical issues, we would greatly appreciate that.
Yes, please. I hope you can hear me now. So yes, long-term plans is to train neurologists, but for short-term, what we need to do is increase awareness in the general public and primary healthcare providers. When we raise awareness of the minutiae that brain health starts to suffer in, and get the primary healthcare involved, then we can, in a much faster manner, get people involved in brain health, protection of brain health, because the neurologist is at the end of the equation. We want people not to get to that part of the equation, or at least know the pathway to that equation.
Thank you so much, Dr. Chavez-Felli. And I want to thank everyone for being here today. I want to thank our special guests for being here and the work that they do. And now I'd like to call upon the president of the World Federation of Neurology, Professor Wolfgang Griswold, for some closing remarks. Professor Griswold.
Thank you, David. Thank you, Tissa. Thank you for arranging this so beautifully. And I think it was an exciting seminar. We have had lots of stimulative talks, thoughts, words, and ideas. I want to thank, of course, the participants, the faculty, and the discussants, and I think also those people who sent questions to us. It was a great team effort this year. And of course, I want to thank also the World Federation's office, Yak, and the committee who did the work. It was a privilege to have the WHO with us, and we really appreciate that. And it was also a privilege to have the EFNA with us as the first time that the patient organization came to our World Brain Days, and it will not be the last time. To summarize just a few points, I think I will take more time that is allotted to me, but I think one of the main points were communicate, collaborate, and be aware. And that's one of the things of daily communication that we should be aware of. We have learned and have been reminded painfully that neurologic diseases are the leading cause of death and disability around the world, and in particular the low and middle income countries. We have learned and have been reminded that we can prevent diseases, and this depends also on the socio-economic and individual possibilities there are. And I think what we have learned and which has stimulated us for this World Brain Day is the IGAP, the Intersectoral Global Action Plan, which in summary is like an advocacy circle. Influence politicians, treat patients, prevent, invest in innovation and research, and include public health. And I think we are very grateful that we could do that. I think one thing personally that's also important is we have to assure that we feel responsible for the individuals, for the trajectory from being conceived till the end of the patient's life. And it's also important that we take care of the end of life. And with that, I also remind of palliative care that is important. One thing that was mentioned, I think it's very important. What is the value of neurology in regard to, let's say, oncology and cancer? Of course, we have equal value, but we perceive correctly that sometimes the prestige of neurology is below more acute faculties. But I think this is something we realize, we have to work on it, and we will definitely improve. It will be a challenge for all of us to implement IGAP, and we look forward to work with the WHO on that. It sounds long, 10 years, it will be short, and it's important to do that. And I also will announce that at the World Congress next year in Montreal, we will also have a topic dedicated to brain health and also a topic to patient issues and patients' organizations. With that, I end, and I thank you again. Please feel free to submit your questions on the website and we will address them later. Again, thank you. And I think brain health for all is that accompanies us and we will pursue. Thank you.